Good morning. My name is Tracy Terlindi. I am the Director of Performance Improvement here at Brownville Memorial Hospital. Today we're going to be talking about health literacy, what that looks like in our community, how we can improve it among our patients, and then we're going to end with a small group exercise. So let's take a look at what health literacy means. Health literacy can be defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So when we're educating our patients, do they understand what we are talking about? Can they relay it back to you? Do they know what you mean? Do they understand the words? So the doctor and the patient need to be a team. They need to communicate clearly with each other. The patient needs to be able to ask questions and be able to relay that information back to the healthcare provider. So when we look at reducing health literacy, let's look at some of the facts about health literacy. Almost 90% of adults have poor health literacy and lack skills to make health decisions. So only 10% of the patients that you see may be able to make an appropriate health decision for themselves and understand what they are being told. When individuals have poor health literacy, it can increase healthcare costs as they may not be taking care of themselves appropriately, managing chronic diseases, taking medication appropriately, which can put them back in the emergency department, increased doctor's visits because they're not taking care of themselves as they should. So this leads to poor health outcomes and again, the medication error, which can increase those healthcare costs because they're not taking that medication appropriately, which brings them back to the doctor's offices more often, and or the ED for unnecessary visits. So let's take a look at the populations who are at risk. They can be elderly, low socioeconomic status, racial or ethnic minority, limited education, and non-English speaking. So let's take a look at our community. So as the survey that we conducted, we have about a population of 750,000, of which most of those are Black, Asian, and or Hispanic. 35% of our population are foreign-born and speak a language other than English. The income average is around $35,000, and 30% of our population did not graduate high school. So a majority of our population fit this population at risk of poor health literacy. So this just goes to show that we really need to improve how we are educating our patients and being hypersensitive to their needs. So the two key components that we are going to start focusing on at the Brownville Hospital to reduce health literacy is providing materials to take home and in the office that are appropriate for them as reading level and or of their native language. We need to address those language barriers, provide an interpreter in-house, and or get used to using the language translation phone line. These are important in order for our patients to understand what we're talking about. We cannot just assume that they know what we are saying to them. So some of the policies that we are going to be following, the National Action Plan to Improve Health Literacy. This is just simply stating that we need to provide health services that are easy to understand in order to improve quality of life and improve health in our patients. And by way of doing that is increasing the education materials that are easy to understand at appropriate reading levels and in their native language if necessary. Other policies that we will be following will be the National Institute on Minority Health and Health Disparities, the National Culturally and Linguistically Appropriate Services Standards, and the Guide to Providing Effective Communication and Language Assistance Services. Many individuals read 5 grades below their highest level of school completed. So if an individual graduated high school, they may be reading at a 6th to 8th grade level. And remember, 30% of our population did not graduate high school, so they may be reading at grade levels way below the 6th grade level. And those are some things that we need to focus on in providing our education materials. So let's take a look at best practices and what that looks like. Some things that we're going to be following. So best practices is simply being ethical in your delivery of care. So we do not want to use medical terms and lots of jargon that our patient is not going to understand. Even individuals with high level of educations do not understand medical terms because they do not have a medical background. We need to be providing shame-free environment for our patients. And one way to do that is getting to know your audience. It is important to know, is your patient elderly? Can they hear properly? Are they able to read properly? Do they have good eyesight? Should they be wearing glasses and are not wearing glasses? Do they need hearing aids and do not have hearing aids? Do they speak English? Those are some things that we need to get to know. What is their highest level of education? These are all important questions to ask at the beginning of the visit, so then we can therefore educate and communicate properly with those individuals when they come in for care. When we provide information, it should not be wordy. It should be plain and simple. And provide an interpreter if needed, so they understand what is being told to them. If they do not understand English or have very limited English, this can increase the risk of medical error and injury after they leave, and again, increase extra doctor visits later down the road and or trips to the emergency department because they're not taking their medication appropriately because they did not simply understand what was being told to them. So when we provide information, it should be in plain language. It should be adaptable and actionable. They should be able to take that and adapt it to their culture if it is in English. It should be easy. When we take a look at this picture of diabetes and knowing the symptoms, it's pictures. It's easy to understand. Frequent urination. Are you excessively thirsty? Are you eating too much? Are you hungry? Do you have foot pain? It should be very simple and easy when we provide information for them. So now we are going to do a group exercise. We are going to get into groups of 3. And this is going to be a role-playing exercise so we can improve communication using a language assistant line for non-English speaking clients. So you will have 3 different scenarios as you will be in groups of 3. So each group you will get to be the healthcare provider, the interpreter, and the client. And each role scenario is going to be different. So each will have a different background that you will be playing and understanding. We are going to send the interpreter out into a different area as you will get the more real effect of using a language assistant line because that interpreter will not be right next to you. So 2 key areas that we want to improve on is using those materials that they can take home, that they can easily understand, that is in their native language and is appropriate. We are going to address those language barriers and cultural differences by way of that language assistance line. So on your table, you have 3 different packets, and each packet has a different scenario in it with handouts and things that the healthcare provider and the client will need to know going into this role play. There's also 2 walkie-talkies at your table. The healthcare provider and the client will be using one walkie-talkie. The interpreter will be using the other walkie-talkie. So you can get that real effect by how frustrating it can be for your clients when they are using the language assistance line and how we can improve that. So you will have 15 minutes to complete each scenario. Decide who will play what role in each scenario. And the interpreters are going to move out into the hallway during this exercise to provide that language assistance line for your clients. So during the exercise, the healthcare provider will be using the walkie-talkie as use of communication. The goal of this scenario is to have the patient be able to teach back the message. Does your patient understand what you're telling them? Did they get appropriate information? Are they able to understand? Can they take this information home and adapt it at home and be able to use it? We will have a buzzer at the end of each scenario, at which time you will have 2 minutes to rotate before the next scenario begins. At the end of these exercises, you will come back and fill out evaluation forms at the end of the exercise. And you will only fill it out as the healthcare provider and the patient. How did you feel during this exercise being the healthcare provider and/or the patient? Was there confusion? Did you understand the message? What barriers existed? Was the message relayed properly? Was that interpreter relaying that message back as being presented to them? So this exercise is to increase your understanding of that poor health literacy and the barriers of patients that do have limited English and/or do not speak English. And we want to come back and get your feedback on ways to improve this throughout the hospital and what we can do. Thank you.